How medical providers are reimbursed and how charges are billed for medical services work a little differently in workers' comp cases due to Tennessee law. These differences provide a maximum allowable amount that services can be reimbursed for. This is called a fee schedule. It's a list of predetermined prices for medical services specific to workplace injuries and illnesses. This list is the maximum amount a healthcare provider can be paid for a particular service. The reimbursement shall be the lesser of the provider's bill, the fee listed in the rate table, after applying any applicable modifiers, methodologies, or exceptions listed in the rules, or a negotiated rate. If no fee is listed in the rate table or in the rules for a service, 100% of Medicare is used. Negotiated discounts between the payer and the provider can be applied. However, billers need to be careful to ensure insurance discounts are applied properly. Negotiated discounts are not always accurately applied. Tennessee law uses a combination of modifiers to offer fair, competitive rates for most medical specialties, but it also includes higher reimbursement rates for certain medical specialties, such as board-certified psychiatrists, neurologists, and pulmonologists. These higher rates are intended to protect access to quality medical care that we have found to be both cost-effective and most beneficial to the injured worker. Some examples of these higher rates are the Tennessee-specific Z codes. Physicians who are certified by the Bureau in our Certified Physician Program are authorized to bill several common transactions at a higher rate. To make the fee schedule more accessible, we have partnered with Fair Health to provide free access to a rate table. The rate table lists out each code and the fee for each service. Please review the rate table carefully, as different rates will apply to different providers of the same service. For example, a movie production company probably pays the construction crew who built the movie set a different amount than they pay the leading actors. We've done the homework for you and listed what the actual allowable rates are in the rate tables. Even more modifiers exist within the rate tables for nurse practitioners, psychologists, and board-certified physicians in some specialties. We'll go into more detail on how to apply these modifiers in the next video. We highly encourage both billers and payers to be familiar with the Tennessee Medical Fee Schedule. If you're new to this, here are some recommended resources and suggestions. First, start by reviewing the program rules. Those can be found on tn.gov. We'll put a link to them in the description below. The rules can help clarify the percentages and explain how the fee schedule aligns and veers away from the Medicare guidelines. Next, check out the Medical Fee Schedule Handbook. This is also on tn.gov and explains how to apply the rules with examples like how to pay for an inpatient stay. Now that things are starting to gel together, check out the rate table. This can be accessed through the Bureau's Medical Fee Schedule webpage. This lets medical providers know how much they can be reimbursed, and it can help employers and insurance adjusters verify that they are paying providers appropriately. For more in-depth topics like bundling and unbundling, make sure you are up to date on the Medicare criteria for those procedures and guidelines. Medicare develops criteria for what codes can be billed together or not. Medicare guidelines apply unless specifically exempted in the Tennessee Medical Fee Schedule rules. And again, check your network discounts. Payers, please be cautious before applying a discount, especially from bill reviewers who might be using old data to modify the totals. Overlooking this has severed working relationships with specialists who either get burned out or were unaware of the discount and stop treatment, which just caused more searching for the payers and more treatment delays for the injured worker. In the next video, we will go over how to use the rate tables. We're required to review the medical fee schedule annually, so check out our website for the latest information. With a better understanding of this process, together we can reduce the number of fee disputes and friction around payment issues. And with less issues, more medical providers just might accept more workers' comp patients and ultimately expand access to quality medical care for injured workers in Tennessee.